is my intention, with the support obviously from the new Minister for Justice, to tackle reoffending, try to analyse why prisoners are coming to prison, being able to maximise our resources to those offences, and obviously being able to create a system that works within the prison, but more importantly, we want to extend all the work that they do here to the outside and create a better system for prisoners in terms of support.
A lot of these youngsters are also very vulnerable. So what help will you offer them in terms not only of rehabilitation, support with employment or education, but in terms of helping them with mental health issues perhaps that they might have, drug issues that they might have?
Absolutely. We currently have the support of the community mental health welfare team, and they help us with all our prisoners. With juveniles in particular, we try to have them engage with both our counsellors. One of them is an expert in addiction, the other one is a more generic counsellor, and we make it part and parcel of their regime. We have compulsory education 5 days a week, we have vocational training, and we have the support of the care agency where they get visits by their care worker. Every time monitoring very, very closely and trying to address this offender behaviour.
Well, children continue to be sent to an adult prison here in Gibraltar, even though the Council of Europe said back in 2015 that it wasn't suitable. And the government has said that it is looking at building a juvenile centre. This was several years ago as well. Nothing has materialised yet. So do you have any updates on that?
It is not ideal to have children in prison. What we do is, like we must do in a small jurisdiction like Gibraltar, is maximise our efforts. And being able to, if unfortunately those prisoners, those young offenders are brought up from the courts, then obviously have a system in place that allows us to treat them in a humane way, allows us to have the proper care facility for them, and being able to offer every single amount of support that they need to make this transition.
But surely a priority has got to be a juvenile centre. Children should not be in an adult prison. Now, when is a building going to go up for a juvenile detention centre?
I myself don't have any forecast date for this, but work is being done on the matter. I know that the new Minister for Justice is very keen on the matter of rehabilitation and the matter of young offenders, and we've discussed the matter at length. It is now possibly a matter for the government to obviously identify a location and a date for when obviously to commence.
Women in prison is another cause for concern because quite often they're on their own with no companions. So what's being done to help alleviate the problems that might arise as a result of being solitary?
Again, what all that the prison can do is obviously offer the support. We offer education, we offer the counselling, we offer work detail. And obviously we have, very luckily in Gibraltar, we have a number of charity groups that do offer services to come in. We try to have the resources available in Gibraltar, care agency, etc. If that prisoner were, for example, to be a vulnerable adult, then care agency comes in, and we maximise those resources to being able to support the person as best possible.
Drugs is always an issue at all prisons, so what are you doing to combat the problem?
Like with any strategy, there's more than one side to it. One is the enforcement, but obviously the other side of it is that of getting prisoners off the drugs. And we currently have a compact scheme that's known as voluntary drug testing, and at present we enjoy 62% of the prisoners being part of that in exchange for privileges. That allows us to be able to tackle that drug problem in prison, and being able to, by the same token, allow them to leave prison in a situation they can possibly then expand on that treatment, expand on that help and support, and possibly stay off drugs upon their release.